My name is Jeannie Carey. I am the Director of Simulation at Baylor University Louise Harrington School of Nursing. As a student in our graduate level DNP program, you will be participating in an OSCE, and this is a brief orientation to that process. OSCE stands for Objective Structured Clinical Exam, and it's a simulation activity during which the student interacts with a standardized patient, or SP, who is a human role player trained to portray a specific patient situation in a scripted and standardized manner. The OSCE provides a structured, standardized, and repeatable format for evaluation of a student's clinical performance. At LHSON Simulation, we offer 3 different types of OSCEs. The first one is the in-person OSCE, where the student will be interacting with the SP in an exam room type setting. The second one is a virtual OSCE, and this is where the student interacts with the SP via a video conferencing platform such as Zoom. But during a virtual OSCE, we want the student to act as if they are together with the patient in the exam room. Therefore, assessments, labs, and any other tests or procedures would need to be verbalized by the student. Once verbalized, those findings will be revealed to the student. So it looks something like the student verbalizing, I am now going to auscultate the patient's lungs, both anteriorly and posteriorly. And after that has been articulated, then the findings are revealed, usually by the standardized patient, telling you something such as lung sounds, breath sounds are clear bilaterally, or crackles are noted in the basis. The third type of OSCE is the telehealth OSCE. This again is on a virtual or remote format where the student and the SP are in 2 different physical locations. However, the telehealth OSCE is designed to give the student the opportunity to practice a true telehealth visit. So we all know telehealth gained popularity during the pandemic, and it's here to stay. So we want to make sure that our students have the opportunity to practice and hone these skills. Obviously, when the provider and patient are in 2 different physical locations, the provider is limited as to what type of assessments he or she can perform. So those are the things that we want you to take note of and practice when you're in a telehealth OSCE. All of the OSCEs, regardless of the format, are recorded. And this is done for a couple of reasons. One, the faculty may or may not observe the OSCE in real time. If they are viewing it in real time, it will be from a separate location, and they'll watch the OSCE via live streaming. But either way, even if they're watching it live, the recording will be available to them to go back and watch and reassess and look for anything they may have missed in real time. Since these OSCEs are recorded, the students will also have access to their recordings of their encounters. And this may or may not be part of the assignment for the student to actually watch their own video and or do some type of self-assessment. But whether it's assigned or not, students are very much encouraged to go ahead and view their recording and do some self-reflection on their performance. So why do we do OSCEs? Well, we already said it's a standardized, repeatable way for the faculty to be able to evaluate clinical competence. It's used in many of the health profession programs, medicine, physical therapy, and nursing. It's a fair and accurate way to assess competence and validate aptitude. It's also a chance for us to identify some strengths and weaknesses in our curriculum. When will you be participating in the OSCE? OSCEs are scheduled as part of a course, and depending on the track you are in, that determines the number of OSCE activities that you will participate in during your time at LHSON. If you're scheduled for an in-person OSCE, that will take place during an on-campus immersion. If you are scheduled to participate in either a virtual or telehealth OSCE, those will be done at a time outside of immersions, and any of these dates and times will be, information will be provided to you at the earliest possible time. And, even which course this is part of, it will be part of the syllabus, and you'll know from the minute that you enroll in a specific course whether or not an OSCE is going to be a part of the evaluation process in that course. So the way we go about offering the OSCE activity for our students is a collaboration between Baylor University LHSON Simulation and Texas A&M Clinical Learning Resource Center. So Texas A&M has a very robust standardized patient program. It services their medical school, nursing school, and allied health professions on all 8 campuses. And therefore, we have decided to collaborate with them to bring these activities to our students. If you are going to participate in an in-person OSCE, you will do that at the Texas A&M Dallas campus, which is located on the 2nd floor of Truett Hospital at Baylor University Medical Center. So as you can see from this slide, in order to bring these OSCE activities to our students, it requires the collaboration of 3 different institutions, and therefore there are multiple players involved, and it can get a little confusing. So our hope is that with this orientation, we can kind of have you gain a better understanding of who's who and what each person's role is. So your course faculty are going to be the ones responsible for the content of the OSCE. The faculty are the ones who determine when an OSCE will be administered, what type of OSCE it will be, the patient content that will be included. The staff at Texas A&M is responsible for the delivery of the OSCE, and that includes the hiring and the training of the standardized patients. And then the LHSON Simulation staff, we serve as the liaison between those 2 organizations. So if you have questions, I encourage you to reach out to me probably first, Jeannie Carey, and you can see my contact information on this slide, and it's also in my email signature, and you will or have already received multiple emails from me. So please don't hesitate to reach out and ask the questions, and I'm probably the one positioned best to decide whether this is a question that I can field or I need to, bring in the course faculty on it or interact with the staff at Texas A&M. If you are scheduled to participate in either a virtual or telehealth OSCE, you will also need to make sure that you're aware and available to participate in a pre-briefing. And this is led by the staff of Texas A&M, and it's conducted via Zoom, usually 1 to 4 days prior to the virtual or telehealth OSCE. You will, again, know this well in advance and can mark your calendar accordingly. An email will be sent to you with a link to the Zoom meeting for this pre-briefing. And there will be a lot of other very important information included in that email, so please read it carefully. The pre-briefing is going to be scheduled to last for 2 hours. However, it will not take that whole time, but I can't tell you exactly at what point you will be finished. The actual content delivered by the Texas A&M staff lasts about 30 minutes, but after that, the remaining time is used to have the students actually log into the platform, which is called SimIQ, and make sure that they are not going to have any kind of technical difficulties on the actual day of the OSCE. So after the pre-briefing, which I said lasts about 30 minutes, you will have a scheduled time during which you will log into the SimIQ platform And you are not going to actually take care of a patient or even interact with a real SP, but there will be a member of the Texas A&M staff on the other end of the Zoom link that you'll be able to, test and make sure that your audio and visual is both performing, and you can hear and see the SP, and they can hear and see you. Another important part of this, of preparing for the OSCE, and this will all be included in that email, but Texas A&M uses the GroupMe app to communicate with students during the OSCE. This keeps them very, very receptive and quick to respond. So if you don't already have the GroupMe app, you may want to go ahead and download that and get that on your phone now. But a special link will be sent to you in the email, and that will be a group within GroupMe that will be for just your course. And that's going to be the way that you can quickly communicate with the staff at Texas A&M to say things like, my SP didn't show up, or hey, my computer just crashed. Whatever it is that you need to communicate to them and make sure they're going to get the message and get it in a very timely manner. I also monitor the GroupMe, but just be aware that many of the issues that students experience are things that I have no control over and really can't do much in terms of troubleshooting. I will say that Texas A&M is very responsive and wants this to be as wonderful an experience as possible. So the GroupMe app and communicating with them via GroupMe and reading the messages from them, they'll put out a lot of helpful hints to the whole group. So just be aware that that's something you're going to want to have downloaded and ready to take advantage of. You'll also get a copy of the Texas A&M Simulation IQ training guide, and that'll be an excellent electronic resource that walks you through step by step how to log in and navigate in the SimIQ platform. So virtual and telehealth OSCEs, again, students will, on the actual day of the OSCE, they will log into the Simulation IQ website, and we strongly suggest you do that at least 15 minutes prior to your encounter to, again, just, calm the nerves and make sure that you're not going to have any technology issues. And if you do have any issues, that there'll be time to resolve them. The link you see here is the address for the Simulation IQ, and this will be provided in the email and at other places for you to access it. And you're going to log in with a specific username and password, and that's going to be based on your 10-digit phone number. So chances are, if you have a OSCE coming up here in the next few weeks, you have already gotten an email from me asking you to submit your 10-digit phone number to Texas A&M via a link. And I also then ask you to go ahead and email your phone number to me so that I can keep a record of it, so that if there is some sort of issue or a time that I need to have that information to help the staff at A&M, it's readily available to me. So on the day of the virtual or telehealth OSCE, again, you will log into the Simulation IQ platform. And if you have not entered your virtual exam room within 6 minutes of the original start time that's noted on the schedule, you will be marked as a no-show. And the reason for this is that the Simulation IQ platform is very much an automated system. And once times and schedules are inputted and the start button is clicked, it's pretty much a train on a track that can't be stopped. And so if for some reason you are running late or having technology issues and you can't get into the virtual exam room within that 6-minute time frame, we're not going to be able to get you in at minute 10 or minute 11 because the system won't allow that. Now, the staff at Texas A&M has been, really good about helping us get you rescheduled to make sure that you get the experience that, was planned. However, just know that it's probably going to need to be at the end of the schedule, and we won't be able to just sort of squeeze you in at some point, because that's not the way the system is designed, and there's really nothing any of us can do about that. For all OSCEs, this is the timing. And again, it's very much automatic, and the times are programmed into the platform, and they tick off as indicated on this slide. So the 3 minutes for the door sign is your opportunity to read a little bit of information about your patient and why they're there. That may or may not take you the full 3 minutes, but it will be available for that span of time, and then it will be gone. After that, you'll have 2 minutes to transition into the exam room. If this is an in-person OSCE, that means you have time to take a deep breath and go ahead and enter into the exam room. If it's a virtual or telehealth OSCE, we're talking about just a matter of a couple of clicks. Won't take you the full 2 minutes, but that's the time that you have allotted for that part of the OSCE. After that, you have 20 minutes in which time to interact with the standardized patient. And the standardized patient will ask you if you would like a 5-minute warning when you only have 5 minutes left. Just know that this is a courtesy. And even if you do request that 5-minute warning, it's still really on you to kind of monitor and keep track of your time, and know that when the 20 minutes is up, the encounter will be stopped at whatever point you're at. And this is really good practice for the real clinical environment, because there very much are time constraints when you're working in a clinic. And so being aware of how much time you have already spent and what activities you still need to accomplish is going to be good practice for you. After that 20 minutes with the standardized patient, you will have 20 minutes to complete a patient note. And while you're doing your patient note electronically within the SimIQ platform, your standardized patient will be completing a checklist to provide some feedback to you. That will be the written feedback, and you will receive a copy of that checklist. However, once you have finished your patient note and the standardized patient has finished the checklist, there's another 10 minutes allotted for verbal feedback. Please do not log out of the virtual or telehealth OSCE before you have an opportunity to hear what the standardized patient has to say in terms of offering some constructive feedback. Once you have completed that portion, then again, there's some time allotted for you to just sort of, thank the standardized patient and leave the room, either physically in the case of the in-person, or, remotely if you're interacting via Zoom. So you have 60 minutes total for that encounter. And depending on the course, you may be assigned to see 2 patients, or it may just be 1 patient. You'll be aware of that ahead of time. But if you are going to see a second patient, that will be scheduled immediately after the first one. So you'll have, time to then move on to the next patient room and begin again with the door sign, and 3 minutes to learn a little bit about why your patient is there that day. The patient note that I mentioned, we had the choice of 3 different formats to choose from, templates, and this is the one your faculty have chosen for all of our OSCEs. It follows the SOAP note format. However, again, because it is very much a automated process, it's a template that can't be altered. So we want you to just use the 20 minutes that you have to complete your note to the best of your abilities. Again, very good practice in documenting in real time. Your faculty may or may not have an additional assignment that includes charting, and just know that you will have access to whatever information you put on the electronic health record. later the day of the OSCE or the following day. It really just depends how quickly Texas A&M can get that information to me. And so you will have access to that if there is a second assignment where that information would be helpful. Your faculty will receive a copy of your patient note after the OSCE has been completed. And I mentioned the SP feedback in the form of a checklist, and this is a copy of that. And you will get this sent to you electronically when your patient note is sent to you, and your faculty will also receive a copy of this. So after the OSCE, you will receive an email from me, and in that email, attached to that email will be copies of your patient notes, your patient charting, and the SP feedback checklist. You will also have instructions on how to access your video recording. But we also want to encourage you, whether there's an assignment related to this or not, to spend a little bit of time reflecting on the activity that you just participated in. Reflective learning is a really good way to gain even more from an experience. And it's really just asking you to spend a little bit of time thinking about the experience you just had, what went right, where were your strengths, and then what didn't go as well as you would have hoped, and why do you think that might be the case? Your faculty will be giving you some feedback as well, but it is very useful for you to be able to first spend some time trying to objectively assess and think about your own opportunity and performance. So I hope this clears up any kind of questions you might have about the OSCE experience. But certainly if this has maybe raised more questions or brought new questions to you, don't hesitate to reach out and ask. We really want this to be a powerful learning opportunity for you. And a big part of that is going to be you feeling confident and is as stress-free as possible. So, you know, if there's questions or anything that we can do to, you know, make things a little bit easier or less stressful, please just reach out and we'll be happy to help in any way we can. So thank you for your time. I hope you found this helpful, and we'll look forward to seeing you soon.